Yeah, sorry, it is recording.
Yes, now it started. Yeah.
Okay.
So, Renu, if you want to make a start now, I think we are ready.
Yeah,
Yes, yes, I
okay.
think we can start.
So, hi everyone. Thanks for joining today's our webinar. We are here with Dr. Rashmi Kulkarni and Dr. Abhay Chopada, I can give the mic to both of them so that they can start introducing themselves and we can start our today's session.
Thank you so much, Renu. So, I'm actually going to take the role of investigator stroke, compare today. But my background is I'm actually a practicing gastroenterology surgeon. And I've been very excited about this field of microbiome over the last few years. Now, obviously, Rashmi is a world expert in this area, so I thought this is a good time for us to start interacting and understanding what is the potential of this really, really life-changing approach towards human health. I wasn't aware of how powerful the human microbiome is. And I still remember when I was in medical school, the key thing we were taught was gut bacteria are bad. You have to just destroy them. And now we've taken a complete 360 and we're saying gut bacteria are absolutely essential for life. So with that, I'll let Rashmi introduce herself and then we'll start our conversation.
Okay, so thank you so much, Abhay, for joining. Thank you, everybody, for joining in spite of your busy schedule. So I'm Dr. Rashmi Kulkarni, one of the co-founders of ARNA Genext Solutions. It's a microbiome resource platform. We'll talk more on that later. But I come from a background of doing research in cancer genetics for over 18 years and working on health and wellness, mostly on prevention of chronic diseases. So my entire focus initially was to try and cure cancer like every other scientist. But later on, I thought, why focus on curing anything if we can prevent it? So that was the basis of this entire journey. And I've been using everything in my own life. So as Abhay said, majority of us don't even know about the crucial role the microbiome or gut health plays in our health and well-being. We'll see what exactly it does. We'll dive a lot deeper, but that is my background. And I remember, Abhay, when we had the initial conversation, the first time we were talking, it was such an amazing conversation that Abhay had already discovered the power. He's one of the very few doctors who knows what the microbiome is, who knows the importance of that in treatment, and he has been incorporating it for so many years. So that was very, very inspiring, motivating for all of us. So that is just my background. And if we talk about gut health, it touches all aspects of our overall health. So I don't know if this is the right time to share my slides to show what the microbiome actually means, what gut health means.
So Rashmi, let me ask you my first question.
Yes.
As a medical student, I was taught that the gut is meant for digestion.
Yes.
And now you're telling me, or rather even I know, that the gut is so much more than that. It actually is the engine of life. And I don't say this lightly at all. Every
Yes.
aspect of human health is actually connected to the gut.
Yes.
Which takes me back to what I used to remember my grandmother telling me, that your diet, you are what you eat. And I used to kind of
Yes.
ignore her.
Yes.
And I still remember her telling me that there are three types of diets. There's a sattvic ahar, there's a
Yes.
tamasi ahar, and there's one more type. And that what you
Yes.
eat actually decides on how you're going to behave.
Absolutely.
Now, can you, purely for our audience, explain what is this gut microbiome and how does it affect us? Why is the gut not just for digestion? What is this
Yes.
miraculous universe inside us?
Absolutely. So I was just reading yesterday that, in one of the gut health news, I was reading that, when people have constipation or something, as people think it's a very simple thing, it's a very common thing. But what they don't understand is it's one of the signs and symptoms saying that there is some problem with digestion. So constipation and poor sleep are actually linked to many chronic diseases later on. It actually is starting 10 or 20 years earlier, which we disregard. We think that, oh, it's a simple symptom and we can totally ignore it. Now I'm going to show you why we need to pay attention to all of these signs and symptoms and how they're going to impact our overall health. So what Abhay asked, I hope you are able to see my slides here.
Yes, yes.
Yes.
Yeah.
So he was talking about our microbiome. So we at ARNA Genext call our microbiome our superhero. So what does it actually mean? When we are talking about who we are, So we are talking about our visible organs. Usually we are so proud to be human. And when we are talking about any disease, we are talking about the heart disease, lung disease, or diabetes as a pancreatic disorder or failure, or kidney disease. So we are isolating all of these organs. But what we need to understand is, if we look at any of the ancient practices, it was a holistic view of the entire, not just human body, but the mind and the environment around it. But if we combine that and the tradition and the scientific knowledge that we have right now, we are also a combination of trillions of microorganisms that live inside and on our body. This is called our microbiome, and this is our invisible organ. Now you will find out why it's our invisible organ. But this is what makes us completely human. So we are human not just because of our visible organs, we are also human because of the trillions of microbes that are present inside and on our bodies. And these are even more in numbers than our own cells. So this might be a bit of a shocking thing for many people. So coming to Abhay's question, so we think that digestion is very important. And like his grandmother, I'm sure everybody's grandmothers are saying the same thing, that we have to focus on good digestion. In fact, there was a question that was often asked. I think a French colleague of mine asked me that, he said that earlier everybody used to ask, how is it going? That meant they were asking about gut health. They were asking about the digestion. How is it going? Were they not constipated? So when we are talking about the microbiome, we are talking about these colonies everywhere where on our body. So they are there on our skin, on our in our oral cavity, in our gut. So for today we are focusing on the gut microbiome, this collection of 1.5 to 2 kilograms of microbes that are present in our gut, in our large intestine. They are everywhere throughout the gut, but this is where majority of them are. And what do they do? So just touching upon a few of the functions, there are thousands more. We don't know everything about them yet, but they play a very, very important role in our mental health. They also help us in absorbing minerals. Now you might think that, oh, so many people are suffering from anemia, they take iron supplements, but it doesn't really resolve the issue for life. Many people take calcium supplements, magnesium supplements. Why do we have to keep taking these supplements? Why can't we get it from our food? And why don't those supplements resolve the issue? That is because these minerals are absorbed with the help of these microbes in our gut. So this is something very important to know. They also help us in making a lot of vitamins, like many of the B vitamins. So people have biotin deficiency, people have B12 deficiency, and they have hair fall, they have skin issues, and many other health conditions or symptoms. And we just cannot figure out where these are coming from. And then again, we do go into this cycle of supplementation. But what if we allow a good microbiome to thrive and allow them to make all of these vitamins that we are lacking? Because they are the ones that are making many of these vitamins for us. They also help us in digesting the food that we eat. We cannot digest it completely. The fiber that is coming from our food is actually digested by the microbes that are present in our large intestine. We cannot digest the fiber ourselves. So if you are eating, if you have constipation or any symptoms related to digestion, bloating, or whatever it is, you might be eating fiber, but you might find that it is not digested properly. Well, there might not be the right kind of microbes to digest that fiber. So that could be an issue. And there are many other things also happening related to digestion. They help us in building muscles. They help us train the immune system. Now, this is a very important function. You might think that what does immunity have to
Rashmi,
do?
is
Hello?
it
Yes.
okay if I actually take you through each of these points?
Yes, yes, absolutely.
Because
You
this is
can.
really, really important.
Yes.
Let me start with mental health, which is the first
Yes,
point
yes.
you made. And it's very intriguing. We all used to think that our entire emotional apparatus is the brain.
Yes.
And then now there is research which is telling us that actually we secrete more hormones in the gut than in the brain.
Yes, yes.
And that everything that we are eating or the state of our health is actually decided by what is happening inside our gut system, which has 10 raised to 16 bacteria, which is more than the stars
Yes.
in the universe.
Yes.
So it's kind of a complete universe inside us.
Yes.
Now, can you
Absolutely.
shed some highlights? And how does this happen and how can we use it to our own benefit?
Yes,
If I
I'll
want to
just
stay
come to
happy,
that in just, I have one slide which talks about mental health. Let me come to that slide. So basically, when we are talking about our mental health, what is mental health? What are our feelings? Our feelings are actually chemicals that are made in our brain and our gut. So when we are talking about all of these chemicals, we are talking about the neurotransmitters, uh, basically like dopamine, which is our reward hormone. So if we clean our house or we do something, we get this immensely rewarded feeling that, oh, I did something productive today. So that is when dopamine is released, not just in our brain, but in our gut. And whatever is made in our gut is made by the gut microbiome, by these wonderful microbes in our gut. So we might see that there's a lot of dysregulation in dopamine when we are using social media, for example. We are burning up dopamine when we watch any content. When we are scrolling through reels, we are actually burning up dopamine. So what that does is it causes or depletion of dopamine. It causes people to go into a dopamine deficit, and that creates a lot of havoc in the body, because that is not just a neurotransmitter. It is also functioning in a lot of other processes like digestion. So when people do not have enough dopamine, they are at an increased risk of chronic diseases like Parkinson's. So there are several studies that have shown this link, that when people have a dopamine deficit, they have an increased risk of Parkinson's disease. Similarly, we can go through other examples of neurotransmitters. Serotonin, our happiness hormone, 95% of serotonin is actually made in our gut by the gut microbiome. So people who are happy, congratulations, you have good levels of serotonin, good enough levels. So you might see that, people
Obviously,
have,
this
sorry,
suggests that we can actually eat and decide how we want to feel.
yes, yes.
But can this be applied to people who are suffering from more established problems like depression or anxiety? Because these are very, very common problems.
Yes, yes, absolutely. It is directly linked. And I'll tell you something very interesting about serotonin now. Serotonin is not just our happiness hormone, it actually controls how fast food passes through our digestive tract. It also regulates the absorption of nutrients. So it is not just so when we say that, the way to a man's heart is through his stomach, it's through this probably serotonin. And when we are able to digest food properly, that is something that keeps us happy. In the evening, that same serotonin is converted to melatonin when we start falling sleepy. And guess what it does? It slows down the passage of food. That is the time when we are not supposed to eat. It slows down digestion, it slows down. So this is something that's quite interesting. So when you are talking about anxiety and depression, they are very closely linked to how we are digesting food. So mood and what we eat are extremely strongly linked. Of course, our entire lifestyle too.
Yeah. I've got a separate question. Now, let's assume someone is suffering from anxiety or depression.
Yes.
Will assessing your fecal microbiome help them actually resolve the issue? Can we use the assessment of the microbiome? Because, yes, it's nice to know this, but how can we use it in real life?
Absolutely. That was a great question. So, when we are talking about the gut microbiome, it is a measurable thing when we are talking about microbiome testing. It can be measured. And a microbiome test actually gives us a very good reading as to what is the status of these neurotransmitters and some more. That what do you have enough dopamine? Do you have enough serotonin? Do you have enough GABA or gamma aminobutyric acid, which is like a brake on our nervous system? Or do you have good enough sleep? So when we have this in the microbiome testing results, then we know that our gut microbiome is not in balance. Then we can take the right steps which are given in the microbiome testing. What are the things that we need to do? We need to bring in the right kind of microbes so that they can start making these hormones or neurotransmitters for us. That is absolutely something that we can do using the power of microbiome testing.
So, is it not then almost that we should do this as a part of our wellness assessment? That we should check our
Absolutely.
microbiome
So,
every year?
yes, yes. So, these are just a few examples, and I'm only talking about neurotransmitters. But what the microbiome testing does, it captures a lot more things. It captures infections that are not detected by conventional testing. It captures what probiotics we are missing. So, I'll just share something with you that, we have probiotic strains, or when we are talking about these trillions of microbes in our gut, there are obviously thousands of types of them. So what happens is that we might be lacking some important strains that are foundational, and we might have an excess of things that are harmful for us. So that imbalance is something that is very important to detect. Sorry, Abhay, you are on mute.
Yeah, let me come back to the area of my interest, which is gut.
Yes, yes,
And we have tons and tons of people who actually have gut issues. In fact,
yes,
there is a condition called stress gut. So they have
yes,
bloatedness, they have belching, they have a constant sense of abdominal discomfort. And a lot of these people, when you test them out, you find nothing. You label them as an irritable bowel syndrome, right?
yes,
But one thing I've noticed with these people is their mood is usually low. They're not very
yes,
happy, active people. They're usually depressed, stressed people.
yes.
Now,
So,
given this, can you just help me how I can address these people with a very, very common problem by kind of assessing their microbiome or manipulating it?
wonderful. I'll just show you an example of somebody who came to us with IBS. I just wanted to show that. So this is something that we did microbiome testing for her. Now, when we are talking about the gut microbiome, we need a very highly diverse microbiome, which means we need many different types of microbes so that they can perform all of the different functions. Now, if you look at this heat map, this is from a microbiome testing report. If you look at this heat map, you can see that this is the non-ideal range, which is in negative. The average healthy user should be around 2.3 to 6, which should be in green. This lady who came to us, she was suffering for 20 years. She had been to so many doctors and specialists and done all kinds of lab testing. She was not able to eat anything that she actually wanted to. So we recommended microbiome testing, and guess what we found? That her microbiome diversity was negative. It was a negative score, which meant that she did not have all of the different types that were required. Two interesting things again we noticed was that she was lacking all of these foundational probiotic strains. Now, what are probiotic strains? These are the foundational bacteria, yeast, or whatever microbes that are required for most people. These are the ones that are helping us digest food, keep our immunity in good shape, and all of the functions that I listed. So when we know now that she's lacking these specific things, we were able to give her these specific probiotics that you take these and your gut microbiome is going to improve in diversity. You are going to get the functions. You will be able to digest the food that you are eating. So she was not able to tolerate milk and gluten and God knows what all. She had a lot of food insensitivities. And the other interesting thing we noticed, third thing, is that she had an infection of Giardia lamblia. Now, you know Giardia intestinalis. So, you know that Giardia is such a well characterized pathogen. How can it happen that in 20 years this was not caught? So, a conventional testing actually did not capture this infection. When she got treated for this, we were like, this is a simple thing to treat. She got the treatment for this. She took the probiotics and she did the personalized diet plan. She followed it for 3 months. She was cured of her IBS, which she thought was a lifelong condition. She is completely cured. She can eat whatever she wants. This is the power of microbiome testing.
That's
This
very
is just one
interesting
example I'm
because, like I
showing.
said, IBS is usually seen as a diagnosis of exclusion.
Yes,
But other very interesting part that I get a lot of people telling me is that they can't lose weight and they feel that if they've tried everything from dieting to exercise, given that you just mentioned that it can affect your metabolic rate,
yes.
can we use the same technique of IBS to somehow control your weight, to gain it or lose
Absolutely.
it?
So, yes, absolutely. So, for people who have weight issues, what we have noticed is in this microbiome testing report, now I showed you that list of probiotics that were missing in this lady. So, it also shows what probiotic strains or what beneficial microbes is your current diet and lifestyle giving you. And in majority of the people who come to us with weight issues or anything like that, they have that it's almost blank. They have nothing in it. They have one or two bacteria. There's hardly anything in it. And then in the other lists where they need to follow recommendations that we give, which is the diet plan, or supplementation where they do not have those microbes at all. That list is very, very long. So when we give them those probiotics that they are lacking, then they start losing weight. Then they start being able to digest food. So why are people not losing weight? Because there's a lot of inflammation in the body. The body thinks it is starving because it is not getting nutrients even from the food that they are eating. When it realizes it is getting nutrients, it stops holding on to that weight. The weight goes automatically.
That's very interesting because you're almost talking about a second messaging system, which
Yes,
is the metabolic switch.
yes, yes.
So, again, let me come back to if we do a complete microbiome assessment, is it possible for us to kind of help person decide whether his metabolic rate is going to be normal, above normal, or below normal?
Yes, yes, absolutely. Because when we do microbiome testing, it gives an idea as to what risk factors the person has for chronic diseases like leaky gut or inflammation or diabetes or whatever. So it gives a very good idea as to where the person stands in terms of overall health and how much nutrition that person is getting from the food or whatever lifestyle that he or she is following. So
Excellent.
definitely, it's a very good indicator of
Yeah.
metabolic status.
There's something else that excites me other than metabolism, and that's immunity. Uh, what we've seen a lot of evidence recently that you can manipulate your immunity via your gut microbiome. And this is really, really useful for us for a lot of conditions like IBD or even cancer. As you know, that cancer cells are a reflection of poor immunity.
Absolutely.
Can you now just help me understand a little more on that area? Because that can be literally, in a way, revolutionary. We've never looked at diet as a cancer treatment or for cancer survivors. We've always tried to go for steroids and immunosuppressants for kind of a hammer approach.
Yes.
So, do you want to just talk a little around that?
Yes, yes, absolutely. So, what I wanted to say is that when you are talking about immunity and all kinds of chronic diseases, so immune system, 70% of our immune system is in our gut. So it is in our digestive tract. And when we are trying to improve our immunity, it needs a very good collection of microbes in our digestive tract to be able to train the immune system, which is directly underneath the gut. It is the gut associated lymphoid system. So when this training has to happen, and this training has to happen constantly all the time. So during COVID, when we were using hand sanitizers and we were sterilizing everything, we did not get that training. That's why people are falling sick so often now. So that training needs to happen, which needs a good enough microbiome. And when we are talking about cancer, it is extremely important for everybody to know that our immunity has everything to do with cancer. All of us have cancer cells floating around, circulating in our body at all times. Cancer is just an error in replication, something that happens during when cells replicate, some errors that are normally going to happen. But what happens is that our immune system is trained. If it is healthy, it is trained to look out for these cancer cells and it kills the cancer cells whenever it sees them. But what is happening in a lot of people who are sedentary, the immune system is not only is not trained properly because of a poor microbiome. The lymphatic system is not moving because they are sedentary. Lymphatic drainage is not happening. The lymphatic system does not have any pump like the heart. So for that lymph to circulate, for the immune system to have those cells going all over the body, it needs exercise, it needs movement, it needs a healthy diet. So all of these lifestyle factors come in here.
So, there's one more question, especially we use chemotherapy a lot in cancers.
Yes,
And chemotherapy is known to destroy all the gut bacteria.
yes,
How should people who've been through those kind of experiences rebuild their immunity? Because we know that people who had chemotherapy actually have a higher risk of a second cancer. In fact,
yes,
it's a well documented fact in medicine. And I can
yes, yes.
clearly see that there could be a correlation between the gut microbiome annihilation and the second cancer occurrence.
Very, very good question. So there are many layers to this. Firstly, cancer itself, when your immune system is not detecting cancer because it's poorly trained or because people are sedentary or for any of those reasons, cancer cells are there and they are multiplying. And when people feed them with sugar, or all of these things that lead to sugar formation in our body, then those cancer cells grow and form cancers. Now when we are talking about cancer treatment, there are different aspects. Even when people go for chemotherapy, there are people who respond very well to chemotherapy and there are people who do not respond to the same chemotherapy even if they have the same kind of cancer. So that response is also modulated by the gut microbiome. So there are experiments done or clinical trials being done where fecal microbiome from responders was transplanted to non-responders. And when they got this responding microbiome, then they started responding to chemotherapy. That is the important role of the microbiome in it.
That's mind-boggling, I'm telling
Yes.
you. If you are trying to tell me that fecal microbiomic transplantation, or FMT as we call it, is actually going to change someone's chemoresponsiveness status,
Yes.
what you're effectively telling me is that cancer treatment is also now going to be directed by microbiomes.
It is very hugely dependent on how, a person's response to chemotherapy or how his overall health is hugely dependent on the gut microbiome. Even in that time where your body is so stressed getting all that radiation, chemotherapy, all of the medications, the person is not going to receive nutrition because even the gut microbiome and the other microbiomes are hugely damaged. So it is even more important to get support by doing microbiome testing, by taking the right kind of probiotics to keep that in good shape. So that is another aspect. And when people finish or complete their treatment, when they are out of that cancer thing, their gut microbiome is already damaged. So they need to figure out what is the status of their gut microbiome so that they can re-establish it, so that they do not have cancers again, because they need to build their immunity. They need to have that surveillance going on in their body.
Rashmi, that's again amazing. I used to think I know a lot about the microbiome, but I'm learning so much more today.
Thank you.
Uh, Coming back to some more chronic diseases other than cancer, because cancer is now a chronic disease. We no
Yes.
longer treat it as a lethal disease. Most of the cancers are curable. But coming to the other lethal killers, especially autoimmune conditions and diabetes, I can kind of extend the same thinking that to say if you're a diabetic, you really now need to get a fecal microbiome test. Would I be right in saying that, or am I overextending?
Absolutely. Absolutely. Now, I'll tell you something very interesting here. I'm sure you might be knowing it, but for everybody else. So, when whoever is pregnant, so this is very interesting that in the first trimester, second trimester, the microbiome is normal. It's not changed very much because, it's the baby is still small. It doesn't need that much nutrition. But in the third trimester, the baby is growing a lot. It is ready to come out in the world. It needs a lot of nutrition. And where is it coming from? The mom is eating almost the same amount of food. It's not that much more. So the microbiome changes to something that becomes similar to diabetics. It actually becomes very similar to diabetics. So to extract more calories, to extract more nutrients from the same food. And that is why, if it is not controlled at that time, if people do not follow a healthy diet, it flips and goes into the gestational diabetes stage. That's why it's so common.
No,
That is the
how
reason.
does it have a mind of its own? Now, I've got a very perplexing question. How does the microbiome know that you're pregnant?
That is because the hormones are also modulating the microbiome. There are different parameters which tell the microbiome that now it needs to start extracting more energy. And so this is the reason why I gave this example, because in diabetes also the energy extraction is very, very different from what is happening in a person who is non-diabetic. So of course, microbiome testing is going to tell us what is lacking, and then they can get those microbes and move to a better state where they are responding more to insulin, they're making more insulin, or whatever that issue might be.
So, will I be right in assuming that everyone who's actually a known diabetic should, in addition to his diabetic treatment, start looking at his gut very carefully, maybe get a microbiome test, and really look
Absolutely.
at his diet?
Yes, absolutely. Because, when we are talking about diet, lifestyle for people who are diabetic, two things that are, there are three things that it can either be because there's insulin resistance. So why do we have insulin resistance? Because we are constantly eating, we constantly have a sugar spike. That sugar doesn't go down in our body. We are making too much insulin all the time, so our body just stops responding to it. That's why we have insulin resistance. The other thing is there can be autoimmunity, because the body is not, the immune system is not trained. It doesn't know whom to attack. It's like you have a huge army and the army is not trained. It will start firing. It has all the weapons. It has to fire somewhere. So it will just start firing randomly on, anybody who is not an enemy. And that's what is happening with our immune system in autoimmunity. So in the diabetes, in type 1 diabetes, that's what happens in children, that it starts firing on its own pancreas. So the pancreas cannot make insulin anymore. It's an autoimmune response. That is also because of a poor immune system. So for diabetics, it is very important to know the status of their microbiome so that they can fix whatever is going wrong.
So in your diabetes, you have to keep your microbiome sweet. That's the way I would put
Absolutely.
it.
That is the only sweet thing you need to have.
So one more thing, there's also a rising incidence of what we call as lifestyle diseases, and this is manifest in, especially today's society. We blame a lot of processed food for it. Infertility is on the rise. Pregnancy is getting more and more tricky. People having a lot of mood issues. Does processed food, I presume, that also affects your microbiome quite a bit?
Absolutely. So again, there are many things in it. When foods are processed, they are far from their natural state. Now, I'm not saying all processed foods are bad. It just depends on how they are processed. But the processing, if it removes moisture, the foods that we are consuming are made to be hyper palatable. They're designed to be hyper palatable. So processed foods normally have a high amount of sugar added, high amount of salt or trans fats, so that when you eat them, you want to eat them again and again. And what happens when we eat not just processed foods but junk foods or whatever that have empty calories, we are destroying our gut microbiome and we are allowing bad microbes to thrive. So the next time they are going to ask for the same thing. They are going to, those cravings are coming from there, not from us. That is the reason why we cannot give up eating all of these processed foods or junk foods or chips and cookies and donuts. That's the reason why, because it's coming from our microbiome. It is
If I eat junk
controlling
food and
our
I have my
craving.
probiotics, I'll be all right, right?
No. So depending on what probiotics you are missing.
Yeah, listen, this has been lovely. But before we finish, I'm going to ask you a slightly flippant question, though it's not really flippant. You know, we all get old, and obviously we have receding hairlines, our skin starts. Do you think probiotic manipulation can help with those areas as well?
Okay,
Can you
another
brief me?
interesting story here. One very fascinating research done, I think 4 or 5 years ago, showed that this study was done in mice. So, as always, whatever studies are done are initially done on experimental animals. So, in this study, what scientists did is they took the fecal microbiome from young mice and they transplanted it to old mice. And amazingly, they saw, I mean, not surprising to me, but the old mice started, their fur was very it was looking like a fresh coat. They started looking much younger. They had all the parameters of youth, even in spite of being chronologically old. They actually started, it was reversing their symptoms of aging. So when we fix our microbiome, when we find the right probiotics that are suitable for us, we take them in limited quantities where, and we let them establish. So just taking probiotics is not going to help, because, you can take all the probiotics if you want, but if you're not feeding them with the right kind of diet, if you're not living a healthy enough lifestyle, the environment is still not conducive. So that is the most important thing to consider.
Rashmi, that really has been a very, very fascinating 30 minutes. You know, there are so many aspects. It feels like we're really looking at a new world. You know, a world which has previously been ignored as we focused only on what our conventional knowledge was. My feeling is at this point, shall we just open the floor to all our
I
viewers if
think
they have
so. Yeah, I think
questions?
that will be great.
There are many questions in the chat as well. People are asking um, is
Yeah,
this help
please,
to is
unmute
this
yourself,
help to
please.
autism as well? Like Rashmi, if you can want to talk about this because people are asking about that.
Yes, so we have received a lot of questions about autism. There are many, many studies done in autism. Autism has been on the rise ever since people have started living industrialized lives. If you see the incidence of autism, it is much higher in industrialized nations, and it is much higher. So when we are talking about, there are no real known causes of autism. You might see that, if the mother has a viral infection during pregnancy, the child is likely to have autism. If whatever, there are many different reasons. So you can't really pinpoint any genetic cause for it. Genetics is very rare, not just for autism, for cancers, for anything. Genetic causes are extremely rare. So when we are seeing the incidence of autism, it is because of all of these combinations of factors. But what we find, or what scientists have found in autism, there is a huge disturbance in the gut microbiome. Neurotransmitters are not being made properly. That is one big reason why there are, speech delays. There's this lack of bonding, where you will see autistic individuals actually totally zoned out and not being able to connect with other people. They could be possibly lacking oxytocin, which is the bonding hormone, or a combination of different things. There are many studies done on that. So if we do microbiome testing, we can figure out, and in many autistic children, we have also found that they have a lot of infections. There's a huge list of pathogens that we have seen in autistic children. And some of those pathogens are known to cause psychiatric conditions. One big example is Toxoplasma gondii. So recently, I had one lady who approached me. She was talking about something completely unrelated, and she told me that 4 years ago she had some nodules in her throat, and so they were surgically removed. The doctor found toxoplasma in her throat nodules, and so I asked her, "You had toxoplasma. What did you do after that?" So she said nothing. The doctor didn't give anything for it, and whatever. I went on. So I said, "Do you know it causes psychiatric symptoms like hallucinations, delusions, and all of these things?" And she said, "I have been suffering from these symptoms for the past 4 or 5 years. Nobody knew about it. Nobody treated her for that. Till date she was suffering from it, and I told her, go and do this toxoplasma test." So this is also something that we see in autistic children. And toxoplasma is just one microbe, but there are many other pathogens that are, known to cause psychiatric symptoms. So definitely microbiome testing is going to give you many different ideas. I don't say we can promise that it has the potential to cure it completely, but many studies using fecal microbiome transplant in autistic individuals have also shown that it improves digestive symptoms, and then it improves the speech symptoms and other symptoms, because that thing is fixed, but it has to be done recurrently.
It's been very fascinating. I can clearly see that having your microbiome assessment can be hugely useful, not just to maintain your wellness, but also as a guide to your treatment in a lot of chronic conditions.
Yes,
Is
yes.
it easy to do this test? What does the test involve?
The test is very easy to do. It is easier than conventional lab tests, because the kit, you get the kit, it's a stool test, you collect the stool sample, and the kit is shipped back to wherever, to where we collect it. So it can be collected from a clinic, it can be shipped to the house, really depends on what it is. And the sample collection, it's a stool sample collection. It's not even blood or anything like that, not invasive at all. And the report takes about a month, because it's an exhaustive 40-page report. The other thing we find interestingly here is, majority of the people who have done microbiome testing with us have antibiotic resistance in their gut. That is also something that we see very commonly.
Very
Rashmi,
interesting.
there's one interesting question here. Is
Okay.
there a certain age or condition when improving the gut microbiome is irreversible? He says this because he's been told that nothing can be done about his chronic iron deficiency and lack of B12.
No, there is no age where the microbiome cannot be reversed. There is no such age. When we talk about the microbiome, it starts with people. I mean, we inherit our microbiome at birth or even before it. We don't know that yet, but definitely at birth, during the process of birth, and the mother is enriching it with the process of breastfeeding. What we see is the diversity keeps on increasing. We get more and more types of microbes from our diet, from our environment. And once we are kids who are 2 or 3 years of age already have a diverse microbiome. Adults have the most highly diverse, young adults. In elderly populations, in senior citizens, the diversity declines a lot. That does not mean we can do nothing to improve it. We can still do a lot to improve it. So there is no such age where we cannot change. It is in our control, basically.
There's one more question on IBD. And I
Yes.
think in IBD, we have already incorporated a lot of prebiotics, probiotics,
Yes.
though microbiome testing has not yet been established as a standard. So I
Yes.
think it's high time that we actually start incorporating that as a part of your workup. We should also do a microbiome test. And one
Absolutely.
fascinating idea you put in my mind is we should start thinking about FMT. If
Absolutely.
FMT is used for people with flare ups, it is quite possible. It sounds yucky, but there are ways to achieve that. But we might be able to save lives by starting to look at the microbiome. Your views
Yes.
there, Rashmi?
Absolutely. So when you're talking about Crohn's disease, ulcerative colitis, or IBD, there are known bacteria, there are known set of probiotic strains that are either lacking in those patients or in too many numbers. I mean, it's too high a number for those. For example, Faecalibacterium protsnici. It's a very well-known bacteria. It's a probiotic that is required for us, and it is lacking in patients who are suffering from IBD or Crohn's disease. It's a well documented thing. And there are many of these that are already well known. So if we do microbiome testing, we know exactly what they are going to need, how to support it with a personalized diet, or do they need supplementation using probiotics. So that is something that is definitely doable. Fecal microbiome transplant, yes, people are doing it, but it's not that popular yet because people are not aware about it. The other thing about FMT is that there aren't enough healthy people. Actually, we need more healthy people for being donors.
No, but once you know FMT, it is
Yes,
possible for you to recreate it
it
artificially.
is.
You don't
Yes,
have to have a human source. I
yes,
always say that if you know what you want to
absolutely.
make, you can make it.
Yes.
But one more very interesting question. If someone is old and has an autoimmune condition, can he still be helped? Or is age a barrier to his reestablishing immunity?
It just takes longer. Age is not a barrier, but you see people who are in their 60s, 70s, 80s, or even after that, people are gaining muscle, people are looking younger, people are reversing their biological age. There are many things that can be done. Similarly, we can do this for the microbiome as well. It might take slightly longer, it might take years instead of months to reestablish that, but it's not something that is not doable.
Yeah. Rashmi, one more question. Now I'm going to come like a devil and say, how accurate is your microbiome testing? And is it not all humbug?
Accurate as in, I will say that there are two extremes that I'm going to say, that this is something it's a personalized medicine. Microbiome field is very nascent, it's relatively new, and all of those things, we still don't know a lot. I'm not going to say that we know everything, but from what we know, it's still very powerful. It is powerful enough to create change. That is what I'm going to say. The other second thing, which might be shocking, is that personalized medicine has already been here since 1989. The first FMT was done by Dr. Borody in Australia in 1989, and still people do not know about it. So it's something that is very well documented. It has been there for a very long time.
So I'll just add to that. The last two Nobel Prizes went to microbiome theory. So it's an extremely, extremely well welcomed area of research for medical professionals.
Yes,
We know the power. Our challenge only has been to incorporate it and incorporate it fast enough. Everyone wants immediate results. The one shortcoming of microbiome manipulation is it's a patient therapy. It's not going to
yes.
happen overnight. You have to work hard. You have to stay very disciplined. And it's not a ready-made solution. Let's put it that way, even when it's personalized. But thank you. I completely enjoyed our 40 minutes of conversation, Rashmi. But I would still want to open it for people who want to just switch on their video cameras and
Yes,
their
yes, I am going to
microphones
remove the
to have a
spotlight so that
conversation
people
with
can
Rashmi because
actually I'll remove the spotlight so that people can actually ask questions. Yeah, please unmute yourselves. Please switch on the webcams. It would be great to actually hear from all of you.
I'll just quickly add on here, Rashmi and Abhay and Renuka
Yes,
here,
yes,
and to all the participants. We've been talking about all the kinds of, mental health. There was a recent research done in a prison where they found that the most aggressive criminals, when they were given SCFA supplements to change their gut microbiome for the neurotransmitters, they actually sobered down quite a lot. So they found that there was a correlation between their gut condition and their mental health and their aggressiveness. This was just an add-on.
Sujata, I'll just add something there which is very, very interesting. I just remembered.
absolutely.
But de-addiction, people who want to give up smoking or give up alcohol, even their manipulating the diet has been very, very useful. I don't think it was whether directly tied up to microbiome assessment, but I know diet played a huge role. Rashmi, do you
Yes,
know
yes.
anything on that area?
Yes, absolutely. So, Definitely, because as I said, whatever we feed ourselves, if people drink alcohol, alcohol is very bad for the gut microbiome. It damages the gut microbiome. It absolutely damages the insulin response as well. So when the gut microbiome is damaged, when there are these unhealthy microbes that are populating our gut, they are going to ask for more and more of the same thing. So it is very difficult to stop drinking once you start. So it is very important to add the right kind of probiotics so that they do not crave, they do not cause the same kind of craving. And it is possible to get rid of all of those cravings and addictions and so on and so forth by re-establishing the microbiome.
Absolutely. I think there are a lot of very interesting questions on the chat. We'll just address a few of them. But
Yes,
one of
yes.
the questions is, does menopause affect digestion? And I'm pretty certain it does because a huge hormonal change. Do you want to talk about that?
Yes, yes, absolutely. So not just it's menopause definitely affects digestion because, for example, if I give the example of vitamin D, calcium absorption requires vitamin D. In menopausal women, it also requires, so it also requires estrogen, but in menopausal women, estrogen is not there. It is not in sufficient quantities. So vitamin D and calcium absorption is going to be impaired. So that has to come from somewhere else, and that needs phytoestrogens or other kinds of supplementations from our food, and it needs the right kind of absorption. So the even the estrobolome, actually estrogen regulation, and even the testosterone, DHT, all of these male and female hormones, even in females, they are regulated to a great extent by the gut microbiome. So even the symptoms of menopause, they can be very severe or they can be mild, depending on how healthy your microbiome is. The nutritional status at that time is also very heavily dependent on the microbiome.
Yeah. There's another question. How does this test help people suffering from psoriasis?
So a very interesting question. So if we are talking about any skin issues, so Renuka was telling me she lives in the UK. She's one of the co-founders of our company.
Yeah.
Sujata Gokhale is another co-founder. So Renuka was telling me that there are a lot of skin issues that are very common in UK. Eczema is one of them. When we are talking about, sorry, when we are talking about eczema or psoriasis, the two important points here is that the health of our skin is again largely dependent on our gut microbiome. People who have psoriasis have a disbalanced or dysbiotic gut microbiome. They also have an imbalance in their skin microbiome. So if we look at the psoriasis patches, they have a different microbiome compared to the adjacent skin that is not showing that patch. So adjusting the gut microbiome plays a huge role in recovery of psoriasis also, because there's inflammation happening under the skin or inside the skin. And that inflammation is coming from whatever havoc is going on in the gut.
I think each of these topics can be a separate
Yes,
webinar
yes, yes,
because what
absolutely.
you are really opening up is a huge Pandora's box. But
Yes.
Renu, my suggestion would be why don't you arrange something where we can get a specialist in, let's say, a skin conditions or a fertility specialist.
Yeah,
We can
definitely.
extract more out of Rashmi's experience
Yeah.
because this is so, at least in my eyes, extremely valuable for people to overcome conditions which are otherwise very difficult.
Yes, definitely.
Yes, yes. So fixing gut health is definitely helpful in managing or getting rid of conditions like psoriasis. There's a lot of research again done on specific strains that are missing or what can be supplemented for psoriasis, for eczema. We did a podcast also on eczema recently. The other thing that you mentioned, infertility. Now, people have hormonal imbalance or they have PCOS, PCOD, or even male pattern, infertility. So, where is all of this coming from? This hormonal imbalance is also regulated by the gut microbiome. It might seem unrelated, but it is when people fix their nutrition, when they fix their lifestyle, when they fix their gut health, they can overcome infertility in many cases. So there are many publications, many reports about that.
Yeah.
So
Does the report provide suggestions on how to rebalance?
absolutely.
The answer is yes.
Yes. So the report provides you with what is missing, what are the probiotic strains that you are getting from your current diet that you can continue getting, what are the ones that you will get from a personalized diet plan that is provided, and what are the ones that you can supplement yourself with. Those are the three
They can also
categories.
consult with you, am I right?
Yes, they can
Excellent.
consult with me.
Excellent.
And it also comes with a personalized diet plan, phase-wise diet plan for 3 months. The first 2 weeks is where there's a gut reset or a detox, where you first clean the gut, and there's an exhaustive list of what you can or should avoid, can eat and should avoid. The second phase is for 8 weeks. That is the phase where you start introducing live microbes, which is where you take the probiotics, you start eating the fermented foods, and you introduce a lot of prebiotics or the foods for the microbes that enrich these microbes. And the third phase is where you start reintroducing some foods that were removed before. So for example, processed foods are completely removed in this, because processed foods that have artificial colors, preservatives, or things like that are going to damage the gut. They are already known to be.
Sure.
So Javed, you are also asking, how does this help with leaky gut? It has everything to do with that. Leaky gut actually happens because there's not a good enough microbiome in the gut. So the microbiome, if it is healthy, it keeps the gut in very good shape. It provides food for the intestinal cells, and there are something called tight junctions in between those cells. So it helps keep those tight junctions in proper position, tight. So what happens when there is leaky gut is that when the microbiome is not healthy, then it allows toxic metabolites to pass through, it allows microbes to pass through. That is where that leaky gut comes in, and all of this starts going in the circulation. It causes inflammation wherever it reaches first, like the pancreas or the skin or the brain or whatever, and then we start seeing symptoms. So when we fix our gut microbiome, it is definitely going to fix leaky gut. And you find out in this report, you get an idea whether you have a risk of leaky gut or not. It will show you leaky gut as well.
When
Thank
you're
you so much.
reintroducing, sorry, I have a question. When you're
Yes.
reintroducing the microbiome or the healthy stuff, is it through natural foods or is it through some supplements that we have to buy
So
from you
all
or
of
somewhere else?
these, yeah, depending on the microbiome report. Now, for some people, so there are 3 lists in this microbiome report. I'll show you one report, a sample report, for example. But if you look at these 3 lists, there is one list which will show you that what can you get from your own microbiome. The second list will show you what you can get from fermented foods by following recommendations for fermented foods, or even the diet plan that you have been provided. And the third list actually gives you what you need from a supplement. So it's usually one supplement that you need to take, not multiple pills, but that is only if you are completely missing those microbes in your diet. That is the only supplement you might need to take if you are completely lacking it. It's not the case for everyone, but whoever is lacking.
Which is commonly available or available?
Yes, it is available everywhere. It's not a very
And
difficult thing
somebody
to
else
get.
also asked the question, the test will happen in India or in UK?
The
The
sample is shipped
testing, the
to,
testing.
yeah, the testing itself, the samples are processed in India. The report comes from there, and that is where
So I've been
it.
looking at the website while you've been talking, and there is comprehensive test, there is diabetes test, there is PCOD, there is, you know. So will the comprehensive test cover all these, or will it be better to go for a specific one? What's the difference?
So the difference is what exactly the difference will be in whatever symptoms you have. It will still cover everything. It doesn't matter what you have. Depending on your condition, you should be selecting what you want. If you select the comprehensive one, it will give you the entire result. So I don't know what is it that you would like to do the microbiome testing for. Depending on that, we can recommend which one you would require.
Where do we have this conversation? Like, how do we discuss which would be
So
a
I am on, if you are on the group, I am also on the group. We can have
okay.
this conversation
I have shared the
virtually,
WhatsApp link as
or
well. To join the WhatsApp link, you can join our link WhatsApp group where you can talk to the Rashmi as well, and then you can discuss about which microbiome testing you have to buy. And we have shared the website link where you can buy it actually. So
Okay.
it's better to join the WhatsApp group so that you
Yeah, I
can
am
get
on it.
updates as well. Yeah.
I am on it. Yes.
Yeah.
Okay. Thank you.
okay.
So, Renu, at that point, I'd like to thank Rashmi officially. It's been a very, very enjoyable and knowledgeable few minutes. So I would hand it back to you, Renu.
Yeah. So yeah, thank you so much. But like there is a one or two questions. Let me give you that chance to the people if they have some questions. We have like is this a test like a SIBO test, Rashmi? They are asking.
No, it is not the same. It is a much more comprehensive test. It is not the same as SIBO. There is another question that is also about from for someone suffering from Crohn's disease and is on biological immunosuppressants. Yes, it can be because when the microbiome is completely restored, when it is restored. But I will also tell you that it is difficult without getting off of those biologicals, whether that person can actually be pain free. That is something that we can reduce inflammation, we can bring back the microbiome, we can improve the environment, we can do all of that. But whether to reduce the biologicals or to stop them, that is something that only the doctor can decide.
Someone is asking here, like Abhay, maybe you can answer is why doctors are not doing this test.
I think they're slowly getting aware. See, the key challenge has been this is an evolving field, which has only come to the fore in the last few years. Now, for doctors to understand and to apply, it takes a long time. I don't think there is any reason we are not adapting it other than not knowing about it.
One more question. FMT sounds scary. What is it exactly?
No. FMT can mean fecal microbiome testing, which is very, very simple. There's another FMT, which is fecal microbiome transplant,
The
which is
transplant.
when you use species from one person to another. That is already used for life-saving situations. So we've got conditions like C. diff colitis. It's a life-threatening condition, but if you do FMT, you can save a life. People are now trying it in conditions like ulcerative colitis to see if you've got a severe flare-up rather than surgery. Can we just do an FMT and try to save that colon? So this is an evolving field. It sounds yucky, but this is what I was mentioning to Rashmi earlier. That if I know what is it that I want to introduce, then I can create it artificially. Don't get fixated on the word feces. To us, feces merely mean a collection of fiber and microbes. So the moment I know exactly what is that concoction I need to create, I can do it in a lab.
Okay.
Yeah, it might sound gross, but the life-saving ability it has, the potential it has, is something else. It's another level, and it has cured people of at least one example is the Clostridium difficile infection that cannot be cured with anything. It is a very painful infection, and that is the only thing that saves people who have C. difficile infection,
So
which
my
is
feeling is,
FMT.
Rashmi, as we grow into our knowledge and our ability to control things, it is going to be more or less a norm to try to manipulate the microbiome. So it's going to be a
Absolutely,
matter of time before we have a
absolutely.
complete understanding,
Yes.
and we will be trying to manipulate it that way. But Renu, I
Yeah.
know this can be a ever never-ending session. I will ask you to now take control.
Yeah,
Now
definitely.
go
So
back to our IPS.
one question is asked that is this covered with the UK's private insurance?
My feeling at the moment is you'll have to discuss it with the individual insurers. These come under the category of novel testing. So they're not traditionally codified. But if your insurance is happy to allow that one-off uncodified cost, you're okay to get it. You'll have to speak with your individual insurer. Not every insurer is going to cover it.
Yeah, sure.
But then
So
my perspective is we spend more than that amount on so many silly things. We
mostly
spend
on the mostly on the
holidays.
food delivery apps, right? Like we post
But
on like buy the things on that.
listen, I've got my own views, and probably I'm very biased because I'm actually a practicing surgeon. So I put a huge value on health. But that's a good question. Thank you. So Renu, back to you.
Yeah, thank you. Thank you so much, everyone. I have shared the WhatsApp link on the chat as well. If you have any more questions, you can connect with us on the WhatsApp group. We provided the like a new research what going on in this field. We always share that content there. If you have any question, if you want to do your microbiome testing or if you want to discuss your any health conditions, feel free. We have a we can arrange the free consultation with Dr. Rashmi as well for to get a understanding of your problem, and then we can recommend you which microbiome testing you can go for. So I think that is the thing. So I have already shared all the details. I have shared number as well, mobile number. You can feel free to read on that number as well. So thank you so much.
And
we
we
are
would
doing,
absolutely love if people can fill the feedback form, if we can share
yes,
the.
yes. Let me share that. Just the last thing we have to sharing that. And
Yes, yes, definitely. That is
I
something,
hope,
because we always work on improving whatever information we can provide. So this is
No,
definitely,
plus
I
if
will
there's
share
any
it. This is
suggestion
the
or
feedback form.
information that you would need, I think that will also be very helpful.
Yes, whatever specific requirements people have, that is also very helpful for us if we know about it. So I've shared the feedback form in the chat. So do fill it out.
please
Thank you
do
so much for
fill
attending.
that form. It's good for us, and like we also know that what we should include the next time webinar as well.
Yes.
And if you're interested to like an in-person webinar in UK, please let me know, because we are arranging many things here in UK now. So please reach out to us on that sense.
Thank you. Thank you, guys.
Thank
Thank
you
you.
so
Thank you so
much.
much,
Thanks,
everyone.
everyone.
Thank
In
you,
spite of
everyone.
IPL, in spite of the weekend, you are still here. All of you have joined. Thank you so much.
Thank
Bye-bye.
you very much
Okay.
for
Thank
joining
you.
this
Bye.
session. Bye.